Hi everyone, this is Alejandra Rodriguez, registered physiotherapist at Stay Active, and today I have with me my great massage therapist, Jonathan Cole, and he's going to talk to us about a massage therapy treatment that's getting more and more popular out there, which is called fascial stretch therapy. So, Jonathan, take it from here.
So what fascial stretch therapy is a focus on the fascial system rather than individual muscles. So we're stretching the fascial system, which is a covering of our whole body. So it's a connective tissue covering that covers us from head to toe. It covers individual muscles as well as all muscle groups, nerves, arteries and veins, as well as each individual organ. And it helps support our structure as well. So when we do fascial stretch therapy, we're stretching the fascia rather than the muscles, which helps to rebalance the body, get rid of any scar tissue that might be in the fascial system, as well as help to decrease pain and increase range of motion and flexibility.
So this, for example, could be a great technique for people that come into the clinic sometimes and they are complaining of chronic lower back pain, those that play a lot of sport or hockey and they have a lot of tightness and pain in their hips, in their glutes area.
Yeah, exactly. So a lot of that tightness just builds up, and our body takes that. And if we don't have any self-care or any professional care to help us release
Or
that
maintenance.
or maintenance, it kind of builds up. So having something like fascial stretch therapy to allow you to loosen up and move the way we're supposed to move is really a game changer for a lot of athletes and people who are very immobile as well and have a lot of lower back and hip pain.
Excellent. And so can you give me
Absolutely.
a treatment today?
Yep.
To show you guys what it's all about?
So we're going to do your other leg because we did the other leg.
Mm-hmm.
Okay. So, perfect. I'm just going to slide touch the bed.
Mm-hmm.
Good. And so what fascial stretch therapy uses these stabilization straps to help maintain the position of one leg while we're working on the other. Because sometimes if you're tight enough, when you're working on one leg, the other one will kind of come off the table or slide around. So we want to stabilize that. So we're going to use a lot of traction to help get that joint space, which helps move the joint. So if I don't use traction, basically that is where she starts to get pretty tight. But if I gently pull, we get a lot more range of motion before she starts to stop me. So traction really helps to unlock the joint and allow us to get more range of motion. So we're going to start with a little bit lighter.
And it also feels really gentle.
Yes, exactly.
I don't
Fascial
feel like
stretch
pull or anything.
Yeah, fascial stretch therapy, one of the best things about it is that it's pain-free and gentle. A lot of people always assume that stretching has to involve pain, but that's a very bad misconception, as your body doesn't really listen to what your mind is saying, oh, I'm stretching this muscle to help release this, but I'm feeling pain. Your muscle will only respond to the stimulus it gets, and if it feels pain, its natural reaction is to tighten back up. So we don't want to get to the point where we have pain, always in a nice, smooth, relaxed fashion. Okay, feel that stretch?
Yeah.
Good. So we're just doing a very quick stretch for Alejandra, just for the purposes of this video. And you can see we're taking her in different ranges of motion, following a routine that works on one joint muscles and then going into two. So right now we're going to work in her glutes, which is a lot of people have a lot of trouble there. And when you do it with massage therapy, you have to really warm up the tissue and get in there. It takes a little bit of time, but with fascial stretch therapy, you're doing it with their own body, which really helps to release the muscles almost immediately because they disarm, because there's no pain, there's no discomfort, and we're just really able to get that deep stretch. You can see how she's not even, giving me any difficulty.
Yeah. And I'm very sensitive, by the way. If I was in pain, you would know.
Exactly. So we do a lot of, moving. A lot of people will isolate a stretch, but that's not the way to do it. A lot of times we want to get that nice gentle motion to help the muscle relax. Good.
This would be great for those people that have a desk job, they're sitting.
Absolutely. A lot of people there. So we're going to show another stretch to help with the desk job people, which is the hip flexor.
Mm-hmm.
Okay, so we're going to have you turn onto your right side. I'm going to give you a little bit of a pillow. Okay.
Thank you.
No problem. You're going to come back with your hips just to me a little bit. Good. And when we take her, and you're going to drop your arm. So right now the hip flexor is what we're working on right in here. And it's the deep muscle. And when a lot of people sit, that muscle gets really tight and over contracted. So what we want to do is open that up, and that really helps a lot of people with lower back pain because the hip flexors actually attach to the lower spine into here and then through the leg into our hip. So we want to really open up the hip. So again, we're going to use traction, and she's going to give me her leg. Let this bend. Good. And I want you to turn your hip gently into the table. Good. Good. You feel that stretch right in here and into the quad a little bit? Perfect. Any pain in the lower back?
No.
No? Good. So right here, we're just going to hang out and really open up the hip, and Alejandra can take her arm and really open up her chest as well and find a spot that really is comfortable for her to feel the most stretch. Feel that stretchy a little bit more?
Mm-hmm.
Good.
And Jonathan, for those people that don't know, what is the fascia?
So again, fascia is the covering of our muscles. It's a connective tissue. So we're really kind of just starting to understand a little bit more of fascia as the year goes on. But basically, people used to always, during their dissections of bodies, used to just kind of peel it away. But now we're having more understanding that it's its own system, it's its own connective system, and it has a lot to do with function and how the body works. And we're only kind of starting to really understand that now.
And the fascia also envelops a lot of the internal organs.
Exactly. Every organ, every structure is covered by fascia. So it all integrates, and sometimes you can imagine it like a basketball net almost. And when you put one finger and you hold it down, the whole net shifts. So if you have an issue, let's say you have one hip that's bothering you and you start to walk with a limp, your whole fascial system will compensate for that, and that will lead to bigger problems. So by helping to center the body and realign it the way it's supposed to work, it really helps to limit any pain, any discomfort, and restore function, range of motion, and flexibility.
Mm-hmm. And also as well, I imagine a lot of people often, they come in and they also say that they're having gastrointestinal issues, or they have asthma, or chronic bronchitis, or things like that. And this can also help them to just to get things moving.
With that, I'm not too sure, but it potentially can, absolutely. By helping to relax the body, it might help them deal with their symptoms a little bit more. Okay, so we're gonna get you out of here. Oh no, so you can take both legs.
Like that?
Yeah.
Okay. And then let's see?
Yeah.
Okay everyone, so I hope you enjoyed today's video, learning more about fascial stretch therapy. And so Jonathan, if somebody wants to try it out, how can they book a session with you?
So you can call Stay Active Rehab or book it online. The number for the clinic is 416-634-0005. And you can book a session anytime. I'm here Monday, Tuesday, and Thursdays.
Yeah, and we also have, you can also request a session online, and our website is www.stayactiverehabilitation.com. So comment below and let us know what you thought of today's video and if you have any questions. And thanks a lot, Jonathan.
Thank you.